I'm Megan and Antara. We are grade 10 students from Raffles Girls' School, Singapore. Today, we'll be sharing about improving the availability of clean water to reduce disease transmission.
So here's our presentation overview. We will be sharing about why this problem should be addressed, more specifically, the impacts on the healthcare system and how the different stakeholders are affected, and our proposed solution and prototype.
So here's a quick introduction about us. We both have avid interest in medicine and are passionate in tackling systemic barriers to good health, as well as bridging socio-economic gaps in accessibility to healthcare. We both realized our profound interest in healthcare through interning at a clinic. My hobbies include dance, art, and engaging in service learning projects.
And I enjoy playing tennis, doing art, and engaging in volunteering.
Our topic is improving the availability of clean water to reduce disease transmission. We believe that this is a significant global healthcare issue, since globally, at least drinking water sources contaminated with feces. Our global economy relies on clean water. Agriculture, tourism, manufacturing, recreation, energy production, and other economic sectors all rely on clean water to function and thrive.
Our topic addresses this issue and poses a plausible solution to this global health problem by purifying wastewater through a complex microalgae bioreactor. Purified, safe, and sufficient water facilitates the practice of hygiene, which is a key measure to prevent not only diarrheal diseases, but acute respiratory infections and numerous neglected tropical diseases. Through our presentation, we hope to bring light to this global health-related problem and tackle systemic barriers to good health.
People from developing countries are the most affected due to barriers in addressing water problems that include poverty, cost of infrastructure, and poor governance. The effects of climate change on the water cycle can make these problems worse.
In those developing countries, women and children are the most affected. This is because children are more vulnerable to diseases caused by contaminated water, and women and girls often bear the burden of carrying water for their families for an estimated 200 million hours each day.
So what causes the contamination of water bodies and how does it affect livelihoods? Firstly, sewage contains dangerous toxins such as diarrhea-causing bacteria. When sewage is in contact with water bodies, microbial contamination occurs. When this contaminated water is utilized to grow food for the community, there's an impact on the food supply and the health of the people who eat it, and there is a risk of transmission of diseases such as cholera, diarrhea, dysentery, hepatitis A, typhoid, and polio. Moreover, when people come into contact with these contaminated water bodies to perform their daily activities like washing clothes and bathing, there is also a risk of transmission of these diseases.
Every year, around 3,575,000 people die from diseases caused by contaminated water. That's one person every 10 seconds, and the majority of them are children under the age of 5.
More than 80% of the world's wastewater flows back into the environment without being treated or reused, according to the United Nations. In some least developed countries, the figure tops 95%. The World Health Organization estimates that 80% of diseases worldwide are waterborne and are spread via contaminated water.
This issue needs to be addressed as it causes livelihoods to be compromised, and it also causes a strain on healthcare systems, especially in developing countries.
In developing countries, there are limited resources to cater to the large number of people affected by waterborne diseases due to contaminated water. Water-related diseases kill a child every 8 seconds and are responsible for 80% of all illnesses and deaths in the developing world. Hospital water supplies can also be contaminated as there is a lack of infection protection practices. This causes more people to be infected with diseases, which causes strains on the limited resources. Moreover, overcrowding in hospitals and lack of hospital facilities causes strains on the healthcare systems.
Here's a real-world example. Microbiologically contaminated drinking water is the cause of many community-acquired and nosocomial infections. Nosocomial infections are referred to as healthcare-associated infections. In the US, 43 outbreaks of waterborne nosocomial infections have been reported, and an estimated 1,400 deaths occur each year as a result of waterborne nosocomial pneumonias. Each year in the US, more than 2 million nosocomial infections occur in as many as 10% of all hospitalized patients, causing significant morbidity, mortality, and financial burden. In developing countries, nosocomial infection rates are high because of a lack of supervision and poor infection prevention practices. Bacteria are the most common cause of common infections. A common bacteria is E. coli, which can be in tropical and subtropical soils, as well as animal and human feces. When untreated water is used in hospitals, E. coli can spread.
So, what are different stakeholders doing to solve this issue? Without facilities to treat water, some countries turn to alternative solutions. Some of the most common treatment options are desalination, solar water disinfection, chlorination, ceramic and biosand water filters, and rain filters. Learning how to better acquire clean water is important to remove harmful toxins for better health of people around the world.
So here's our proposed solution, an algae bioreactor which makes use of wastewater to grow microalgae, which will also purify wastewater and of clean water. The benefits of microalgae are, it could be grown on wastewater nutrients and scaled to commercial production. And then it could perform wastewater treatment by removing nitrogen, phosphorus, and dissolved organic carbon. Those growth conditions destabilize harmful bacteria while yielding more energy-rich biomass than current treatment systems. It can also be harvested batch-wise nearly all year round, providing a reliable and continuous supply of clean water. Also, despite the high production yields of microalgae, a smaller land area is required compared to desalination plants. Moreover, algae is relatively cheaper to grow. In conclusion, an algae bioreactor is a possible solution, especially since it's cost and space efficient. Here's the picture of our prototype. In conclusion, we hope that this presentation was insightful, and we hope that future generations are able to equip themselves with the knowledge and awareness of such problems faced by different communities in order to create solutions that will benefit the disadvantaged population.
Here are some links you can visit to get more information about our prototype. If you have any other questions, please feel free to visit the link in our Padlet and we will try to answer your questions ASAP. Alternatively, you could scan the QR codes. Thank you and have a great day ahead. Or good night.